I just want to say a word about the whole acetaminophen in pregnancy debacle that is. Um, what is the evidence? I think we all had this intuitive sense when the president back in the day was like, hey, we should inject bleach and stick a light down in our bodies, that was probably not going to work. But this thing about acetaminophen and risk of autism spectrum disorder, that's a little bit of a different beast. On the one hand, there is evidence that suggests an association with acetaminophen use during pregnancy and risk of autism or ADHD. However, there are a number of studies that show no such association. And it appears that the highest quality evidence with the largest studies that are the most cautious in adjusting for obvious confounders, there really does not appear to be an association, especially if you control for sibling matching, meaning the familial tendency toward autism spectrum disorder. When you control for that, the apparent effect seems to disappear. That said, all of these are observational studies and there is no causal link. What I would say is, let's just stop being so overly dogmatic on both sides of the thing, saying, oh, it definitely causes it, okay? So President Trump, RFK, take a chill pill, okay? And on the other side, those of us who are in the scientific community are maybe being a little bit overly reactionary and saying, there's no link at all. There's mixed evidence, which makes this very difficult to interpret, which means that it's a matter of clinical judgment. So what I would say is, let's take a look at the literature. Let's take a look at the evidence. Let's be driven by the evidence and not by our emotions, okay? Because that's not going to get us anywhere. And if you have a question about acetaminophen use, don't talk to RFK. Talk to your doctor.